If you're a senior and you want your bunions to go from this to this, keep watching. 350,000 Americans undergo bunion surgery every single year, with 10 to 50% of them experiencing complications from the surgeries, and many will need to go back under the knife for another bunion surgery. And the sad reality is that many of these surgeries could have been prevented via natural treatment solutions, like wearing a specific type of shoe and some unique exercises that we're gonna talk about. As an orthopedic physical therapist, I've helped countless men and women to go from this to this and this to this in my practice through natural, simple, effective treatments that you can perform at home. I'm gonna go over the exact treatments that I use with my patients in today's video so that you can get started reversing the angle of your bunion and finding relief today. Before we get into the natural treatments that we use, it's important to understand what a bunion is. A bunion, formerly known as hallux valgus, is a medial deviation of the first metatarsal bone and a lateral deviation of the big toe. What results is a bony prominence on the inside part of your big toe that is unsightly and sometimes painful. Bunions can range from mild to moderate to even so severe that the big toe actually curls underneath the other toes. Now that we know a little bit about what bunions are, we need to know what causes bunions. Modern medicine has utterly failed in the treatment of conditions like bunions and many others. Now, there's some really good things going on in modern medicine, but also some really bad. The good is that we've had some major advances in medical technology that have allowed us to have new imaging techniques to see problems from the outside without having to go in and do surgery. Emergency and acute care has also seen major advancements that have saved countless lives. And pharmaceutical and surgical innovations have increased such that we're able to target and treat specific diseases and prolong life. Yet there's also a lot of bad things going on in the medical world today. We have an over-reliance on treating symptoms instead of the root cause of the disorder. A great example of modern medicine's failure to treat the root cause is diabetes. With diabetes, the pancreas becomes less efficient at producing insulin, and the cells themselves become insensitive to the hormone insulin. Yet our treatment is to pump people full of more insulin, thus making the cells even less sensitive and increasing insulin resistance long term. In other words, we're solving the short-term problem of a lack of insulin, but making the long-term problem worse. We also have a reactive and not a proactive approach to treatment. We'll take the example of diabetes again. Most folks with pre-diabetes are told not even to worry about it until they're full-blown diabetic. Yet it would be much easier to have an ounce of prevention when you're pre-diabetic than 10 pounds of the cure once you're diabetic. There's also overuse of pharmaceutical interventions today, well before many of the natural treatments have been exhausted. This is due in large part to the fact that the natural preventative treatments don't make a lot of money for the pharmaceutical or the healthcare industry, and thus are pushed to the side in favor of the money-making medications and surgeries. We're gonna talk about some simple natural solutions to bunions for seniors in just a minute. Modern medicine treats bunions as if they are a genetic condition that you are predestined to get regardless of how you live your life. Thus, the treatments prescribed are things like over-the-counter medications, ice, padding, orthotics, and then eventually an inevitable bunion surgery. The sad reality is that 10 to 50% of bunion surgeries result in some form of complications. That's simply way too high to risk before you've exhausted all of your other options. Even expensive custom-made orthotics don't work long-term to treat and resolve bunions. A 2012 study by Reina et al. Took 54 women who suffered from bunions through a protocol of wearing custom orthotics for an entire year. At the end of the year, after wearing these custom fancy orthotics, there was no statistical difference in the angle of their bunions. In other words, the orthotics did not work to help find resolution of symptoms. Now, there's some aspects of bunions that you cannot control, and of the 65 million Americans who struggle with bunions, more of them are women than men. More folks that are older struggle with bunions than younger. And many folks have a genetic predisposition towards bunions. And there's also some neuromuscular conditions, such as Down syndrome, that lead to a higher likelihood of forming bunions. Yet there are three major drivers of bunions that are very much within your control. The first is wearing shoes with a narrow toe box. The shape of modern footwear is not conducive to a healthy, naturally spread out foot, but rather it confines the foot and drives it towards the development of bunions. So how do we end up with these narrow, somewhat pointy shoes as the standard for fashion in our world today? Well, hundreds of years ago, cowboys were trying to figure out the best shoes to fit within the stirrups of a horse. And they found that shoes that were pointy and more narrow fit better within the stirrups than traditional wide shoe wear. People that rode horses often had more money than people that didn't ride horses, and so folks started wearing pointy shoes as a symbol and status of wealth. What they didn't know that they were doing was confining their feet and their toes to generations of bunions later on. The natural, healthy human foot is meant to splay out. As you can see in this picture right here, there's a foot that has never worn a shoe before. It's wide, there's space between the toes, and then right next to it is the foot of someone who's been wearing shoes for just a few weeks. You can already see the foot starting to look less like a foot and more like a shoe. The absolute worst shoes of all, high heels. Not only do they confine the foot to a narrow V shape in the front, but the heel pushes the foot forward and accelerates the formation of bunions. Avoid these at all costs. Sorry, ladies. Modern shoe wear is a lot like wearing a cast. If you've ever broken a bone before, like an arm or a leg, you know that after you took the cast off, for an extended period of time, you dealt with atrophy in the muscles that were casted. Now, wearing traditional confined shoes is very similar to this. When we wear those shoes, it makes the muscles inside of our foot weak and atrophied. And so they're not ready to take on and withstand the demands of day-to-day life of a foot. We've created shoe-shaped feet when what we really need is foot-shaped shoes. More on that in a moment. Number 2 is limited ankle dorsiflexion. When our ankle dorsiflexion is limited, it forces us to compensate with motions like walking by rolling into a flat foot position and utilizing the hallux valgus or bunion motion of the big toe. Over time, this will drive the formation of bunions. Number 3 is flat feet and weak ankles. Because of the flat nature of the foot, when you walk or when you stand, it will naturally drive more of a bunion position and over time lead to the formation of bunions. It's the same with weak feet and ankles as well. If you don't have the strength and structural integrity to hold your foot in the right position, you will naturally move towards the position of least resistance, which is often a bunion. Next, let's get into the 5 steps to treat your bunions naturally and avoid surgery as a senior. Number 1 is to wear shoes with a wide toe box. Like we talked about, conventional pointy shoes drive the foot into a bunion position, and natural wide shoes allow the foot to spread out and restore natural foot function and shape. There are numerous brands today that make a barefoot or a wide shoe. Some of our favorite brands are Vivo Barefoots. These are Vivo Barefoots that I've had for a decade. These are my little 3-year-old's Vivo Barefoots that she just got. They're super cute. Zero shoes. These are my wife's super sexy Zero boots. And there's also pretty cool barefoot sandals. So my wife has these B. Lenka shoes that are very trendy, fashionable. She wears these in the summer when we go on dates, and they're wide. They don't grab onto the big toe, and they allow the foot to spread out to its natural position. Also, shout out to Anya's Reviews. She has a really cool Instagram where she reviews barefoot shoes and talks about the best companies. Highly recommend you go check that out. Number 2 is to wear toe spacers. There was a really interesting 2017 study that was done that took 90 participants and split them into 2 groups. All of them had bunions. One group just wore barefoot shoes, and the other group wore barefoot shoes and a toe spacer for about 2 hours per day. At the end of the study, both groups showed improvements in their bunion angle, but the toe spacer group had an even greater improvement. Now, what's really interesting about this study is that toe spacers work better than no toe spacers, but with our patients, we tell them to wear toe spacers as often as possible, all night long, all during the day, especially when they're working out, when they're wearing shoes, as much as possible. And so we see an even bigger improvement, and quite often very fast, in our patients that we work with by wearing toe spacers. Some of our favorite toe spacer brands are Awesome Toes, and then our friends over at Buy Buns have put together a pretty cool bunion kit that has resistance bands that we're gonna use in our exercises today, and then also a couple different types of toe spacers. They have one that fits really well within the shoes, and then one for wearing when you're not wearing shoes that's a little bit wider. And I think you need both if you're really gonna go after restoring your bunion angle. And number 3, wearing toe socks. I love Injinji's toe socks, especially for folks with bunions, because they create a little bit of extra space between the toes and help with preventing and reversing the formation of bunions. These are something you can wear all the time. They're easily findable online, and I'm sure there's numerous companies that make them. Injinji just happens to be my favorite. Number 4 is limited ankle dorsiflexion. This could be due to tightness in the calf muscles or actual stiffness in the ankle joint itself. Whatever it is for you, it may be driving you into more of a bunion position as a compensation to make up for your limited ankle dorsiflexion. When we get to the exercises in just a moment, we'll go over specific targeted treatments for both limited ankle dorsiflexion drivers. Number 5 is weakness in the foot and ankle muscles. Research done that compared folks with bunions to folks without showed that the abductor hallucis muscle, or the muscle that brings the big toe in towards the middle of your body, was half as strong in folks with bunions compared to those without. There are numerous other examples of foot and ankle muscle weakness in those with bunions compared to those without. Therefore, improving your foot and ankle muscle strength is imperative if you want to find resolution from your bunions. I'm gonna go over the 3 best exercises for treating and resolving your bunions. The first is toe splay. As often as possible throughout the day, you're going to squeeze and open your toes as big as possible. I recommend doing these a minimum of 25 times, 3 times per day, but you really can't overdo this one, and feel free to knock yourself out and do as many as you want throughout the day. The second is the big toe band calf raise. Now, this is where I think the bands from Buy Buns work really well for this. We strap a band around both big toes to hold the big toes into a neutral aligned position, and then perform a calf raise, driving through the big toe as you lift your heel up. Do at least 25 of these, and then eventually you can progress these to single leg, really being conscious to keep that big toe down and avoid rolling onto the outside part of the toes. This exercise is gonna be really helpful for restoring foot and ankle strength and helping you find resolution from your bunions. The third and final exercise is a band ankle dorsiflexion stretch. You can do these with your knee straight to target more of the calf, and with your knee bent to target more of the ankle joint. The band acts to pull the talus, or the domed ankle bone, backwards and allow your ankle to move more into dorsiflexion. Finding relief from bunions and avoiding bunion surgery is possible. You just need to get in the right shoes, do the right movements, and wear your toe spacers as often as possible. You do these things consistently over the course of a few months to a few years, and you'll notice a dramatic improvement in the angle of your bunions. If you want more videos like this, where we help seniors to build healthy, active bodies, hit the like and subscribe button below. Until next time, I'm Dr. Matt.